If left untreated, the human immunodeficiency virus, or HIV, can lead to AIDS, which has claimed 42.3 million lives since the disease first surfaced in 1981. Almost 40 million people live with HIV globally, a large portion of them in Sub-Saharan Africa. However, for the first time ever, the majority of new infections over a 12-month period were outside this region. The news was revealed during the ongoing International AIDS Conference in Munich, which occurs every 2 years. And it's been widely welcomed across Africa.
It means that we are doing something right in terms of treatment, in terms of testing, in terms of prevention, but in terms of keeping our patients in care. We have not reached 100% of people who have tested positive, linking them into care and ensuring they stay on care.
However, the hard work doesn't stop there. Activists stress that African countries must continue to guard against new infections, which continue to show alarming increases among the continent's young.
You find that young people fear pregnancy more than they fear HIV. You find people fear diabetes more than they fear HIV. A lot of it is attributed to the fact that you can manage, you can live and thrive with HIV. But we have to be very careful that we are not promoting living and thriving with HIV.
South Africa carries the world's heaviest HIV/AIDS burden. According to the 6th South African National HIV Prevalence Incidence and Behavior Survey, more than 7.5 million people are living with HIV, with prevalence rates lingering at 12.7% of the population. Stigmas related to the illness remain, which can lead to feelings of shame, fear of disclosure, isolation and despair. Joseph Mutlonga was diagnosed 30 years ago and is one of 2 million people on a comprehensive treatment program run globally by AIDS Healthcare Foundation. He's now working to help others understand that they can have a future after a diagnosis.
To hear that you are HIV positive, it will be a shock. It's like someone has died. I think it's where they must now do the adherence counseling, encourage them that there is life after being tested positive, and you can still live longer once you are taking your medication.
However, Africa's battle against the disease remains a bumpy one. As donor funding shrinks, the continent remains disproportionately affected by poor healthcare services and a lack of affordable medicines, issues that are being raised by South Africa's high-level health delegation at the AIDS conference.
We need to advance technology on vaccine, for example, long-acting ARTs. We need to push for those so that we don't get products and commodities at higher prices. I think we need to do that.
Sub-Saharan Africa has made significant strides in HIV management, but continued global collaboration is crucial to ensure better access, particularly for the world's most vulnerable populations. While the UN's target of ending AIDS by 2030 appears unachievable, progress is ongoing to make HIV a manageable chronic condition. Chirishara, CGTN, Cape Town.